Hello everyone, hope you guys are doing well. Today I wanted to talk about the topic of aphasia. So aphasia is the language loss or disorder following brain damage. So there are two parts of the brain that are very central for language learning and where words are kept and all of that. So those two areas are called the Wernicke's and the Broca. And these two areas are very important for language. So the Wrinkles aphasia, we're going to talk about Broca's aphasia really quick. So that one is about poor comprehension, where people aren't able to comprehend words they're able to speak words very fluently. It's also called fluent aphasia, but they have poor comprehension and are not able to they're not able to clearly explain something that they're thinking about. Now we're going to talk about non-fluent aphasia. This is the one I'm going to go more in depth with. So this is when someone does have a good comprehension of what they are trying to speak, and they are able to understand in their brains what they want to express, but they have a grand difficulty in finding the exact words that they need to say. And so one example for this is this disorder can cause someone to lose their words. So it's like a tip of the tongue type of thing, where they are trying to speak something but they can't say the word exactly. And this is also called paraphasias. So this is the use of substitution words for word. So for example, I'm going to have a few examples from the list that I was given. So when a patient is told to repeat the word liberty, they don't say liberty, but however, they say the word freedom. So this is another word for liberty. Is freedom. They're very similar words and they mean the same thing, but they're not the same word. And so that is one thing that will happen. Another example is when someone says abroad. Instead of repeating the word abroad, they say overseas. And this is something very interesting that happens. Another example that I want to go into is when the examiner says the word large. And instead of repeating large, they will repeat long. So when something is large, usually it's long or big and fat. But instead of saying large again, they say long. And then short, when the examiner said short, they said small. So when something's short, usually something is small. But it doesn't necessarily mean that it's short, it's just small. So that is the switching of related words. Another example we could say is, for example, if someone's trying to say dog, instead of saying dog, they say cat. It's something very related. Or they could say, if they're trying to say horse, they might say house, because house sounds a lot like horse. And so this is the type of damage that happens to the brain and how the brain comprehends language as it's trying to figure it all out.